Hey, Flourish family, you are watching our first ever health education video. Today we are going to start with talking about labs. How do I read my labs? What do they mean? What are the things that you as a patient need to be aware of when you go in, get labs done, and then have them reviewed with your provider? So going to break things down, shouldn't take too long, but it is a very important thing that a lot of people don't understand. How to even look at labs and what do they mean when they get them? So first of all, I'm going to use some examples from my own personal labs. I don't care. So just so you know, it's not an actual patient, they're mine. And then some different visuals. But to start, I think I literally hear every single day when I talk to patients, they all come to me and they say, I went to the doctor with XYZ symptoms. They checked my labs and everything's normal. There's nothing wrong with me. Everything's normal. That's what they told me. Truly hear this every day, okay? So you come to me and we draw some labs, maybe the same, maybe some others, maybe some additional, and that is not what I tell you. So why is that, okay? When we look at labs, we are looking at the normal range, right? The reference range. And then we are comparing that to what our numbers are. So let's take, for example, a thyroid patient. So I'm at home and I don't feel very good. I'm tired, gaining weight. I feel cold all the time. I feel like I can't lose weight no matter what I do. I have no energy. My skin is super dry. And just to be thorough, let's check on Dr. Google to see what other thyroid symptoms I might be having. So we go to the computer, we're like, ooh, I think I have a thyroid issue. So fatigue, yep. Increased sensitivity to cold, yep. Constipation, yep. Dry skin, weight gain, puffy face, hoarseness, muscle weakness, elevated cholesterol, muscle aches, yep, hitting all those. Thinning hair, depression, memory changes, yes, all those things. I have them. I must have a thyroid issue. So I go to my doctor. They check all my thyroid labs, all of them, right? And then I get a note from them saying, oh, everything's normal. You look great. You don't have a thyroid problem. Okay. So what does that mean? When they go in, check your labs, and they come back as normal, right? So let's break this down. When you get your labs back, again, these are my labs, my personal labs. When you get your labs back, you will have the test that they checked. You will have your results, right? And then you will have what we call a reference range or a normal range. Reference range, normal range, reference value, it could be called different things. And that is normal, okay? What most people don't realize is that this reference range is only referring to a 95% confidence interval. What does that mean? That means we look at hundreds of thousands of women, men, depending on what age we're checking. So hundreds of thousands of women my age, we look at their labs to determine that reference range. Same thing for you in whatever age you are and gender. So we get a 95% confidence interval. So out of those hundreds of thousands of people, we find where 95% of people fall, and then we get the high and the low, and that's what that reference range is referring to, okay? The problem with this is that this reference range doesn't take into consideration whether or not those people have a thyroid disorder or have too low of vitamin D or have an illness of something going on. It's only the 95% confidence interval where 95% of people fall. So if you come to the doctor, if you come to see me, and you tell me all these things, you list off those things with the thyroid that we just talked about, and I check your thyroid labs and they are in the reference range, I very well may tell you your thyroid is not normal, even though it's in the normal range, because 95% of people may fall there, but 60% of people have a thyroid disorder and an undiagnosed thyroid disorder. So yes, you may fall in the 95% normal range with those 60% of people who also are not normal, okay? So that's a really important thing to know and to understand when you're looking at labs. Not all lab values have an optimal or kind of a range that we look for that we know are necessary for the functioning of your different cells and different systems of the body, but some of them do. For example, vitamin D. Vitamin D, the reference range of vitamin D is 30 to 100 for the majority of people. That's where 95% of people fall. However, we know from the literature, from the data for the last 80 years, that you need at least a minimum of 60 to 80 for vitamin D to protect your bones, to protect your teeth, to improve your moods, and to keep those cells reproducing and staying healthy like they should. So that's kind of the other side of interpreting lab values that you may or may not know about. When you come to Flourish and you're a patient at Flourish, we talk a lot about optimal lab values, okay? So yes, what are those normal reference ranges, but what are optimal? So optimal are going to be labs that we know will prevent disease. They'll protect you from other diseases or disorders where you're not symptomatic, and they're individualized to what your optimal need to be based on your symptoms. So if someone comes in here and they tell me every single symptom of a thyroid disorder, I'm not going to tell them, no, you don't have a thyroid disorder because you're normal, right? We need to look and see, what is that optimal? Are they falling in the optimal? Are we checking the right labs? And then use those along with their symptoms to determine what is that patient's normal. So hopefully that's helps kind of provide some guidance and clarity on how to interpret lab values. If you have questions, feel free to leave them in the comments, message us, and we will see you next time. Bye.